IVM.
Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to another episode of All Things Policy. I am Priyal, a research analyst working at the Takshashila Institution, and I have with me my colleague Mahek, who is a program manager. So in today's episode, we are going to talk about the need for Indian health services and the potential roadblocks that we will have to deal with to form this structure. Now, to begin with, I want to ask you, Mahek, is what exactly are we saying when we talk about Indian health services? And when we say IHS, right, how did the idea for it originate? Because from my very basic surface level reading, what I understand is that earlier there was a system in place called IMS, Indian Medical Services, which was established by the British colonial rule. Now, could you give us broader understanding of the same?
Yeah. So with the Indian Health Service, we basically mean introduction of another administrative service in the country, specializing and working towards the betterment of health on ground in country. So at present, India in total has 22 administrative services, for example, IES, IFS, IRS. So the plan is to bring another cadre with the name Indian Health Service to bring about specific positive changes in the field of health. And an Indian, as you correctly pointed out, an Indian medical service is something that the country has seen before. So we'll have to go back to the time like pre-independence. So when Sepoy Mutiny happened in 1857 and the power was actually transferred from the East India Company to the Crown in Britain, at that point in time, there were three specific health services in Madras, in Bengal, and in Bombay. So after the War of Spare Mutiny, these cadres were combined and an Indian medical service was formed. So the year was 1857. And the cadre was actually formed to improve the state of public health on ground. But the fact is that earlier it was only formed to perform military functions to take care of military personnel, their health services. But later, it was actually found that the Indian medical service also performed many civic functions. And they were widely recognized, especially they actually helped in establishing a lot of hospitals in many regions across the country and also in treatment and promoting awareness against diseases such as cholera and glaucoma at that point in time. So we know that open defecation and sanitation is very much a problem in the country even now. So imagine a situation more than 100 years back. So the Indian Medical Service, a lot of personnel from Indian Medical Service were actually appointed to look after the sanitation problems in the country, to promote awareness, to see what can be done. And like further, when this Indian Medical Service was formed and after its success, under it, a lot of other medical services were also formed. Like there was central and provincial medical services, there were subordinate medical services. But the fun part is that even though it was an Indian medical services, for a very, very long period of time, only British officers were made a part of these services. It was actually it was actually many years later when when an Indian person, that to a man, was appointed as given a temporary position in the Indian medical services. And even after 50 years, when the service was formed, so this was the time around 1908, it was the Indian people in the service only constituted to 5%, that to temporary positions. There were no permanent positions given to them. And so that point in time, the Indian National Congress which was actually fighting against the British Raj, actually also spoke a lot about Indianizing the Indian medical service, because it thought that people who are being treated are Indians. So it should be Indian officers who should be in charge of taking a look at them. But the Britishers were, of course, against it. A lot of memorandums were formed, and even the Crown had completely rejected the idea of a lot of positions being taken by Indian officers. But when World War II started happening, there was a need of these European officers who actually had to be sent to take care of Europeans and British officers in the war. It was only then when a lot of appointments started happening. A lot of Indians were given positions, remembering only temporary positions. No permanent
Right.
positions were given. And that actually started the decline of IMS because nobody was taking it seriously. There were only temporary positions given to Indians. And then this was just before the independence that all the Indian officers in the IMS at that point in time were given voluntary leave with pension till their retirement. So they were paid without being getting the work done. So that
Oh,
started the decline of IMS. And then, of course, after 1947, the partition happened. Nobody took it very seriously. And
right.
since then, we have been living without an IHS in the country.
Right. So, like what you said is really interesting, right? Because you said that IMS actually had contributed to like the civic health and in establishing hospitals and everything. So they
Mhm.
kind of had a structure in place when they were functioning. So now, if we were to develop an Indian health service system, so would it be
Mhm.
developed using the IMS model? Would it be advisable to do that? Or is it better to have like an entirely new structure in place, completely disregarding the IMS system?
Yeah. So as of now, since there is no structure on which the IHS would be based, we clearly cannot say what can be the structure in future. But I know that there will be a lot of structural differences and formational differences. First, I don't think that there is a need of having temporary and permanent seats.
Right.
And I'm pretty sure if IHS follows the route of other administrative services in the country, there will be any permanent and temporary positions. Moreover, now health in India is governed completely different how it was governed during the colonial time.
True, true.
And in when IMF was formed in pre-independent India, only medical officers, maybe people who were specialized in medicine, clinical medicine, were appointed as medical doctors. I'm not really sure if that will be the structure that we'll be basing on because health is just not medicine. It's much broader. There is actually clinical health and there is public health. There are a lot of other nutrition comes into play, sanitation comes into play, water comes into play.
Right.
And probably a doctor might not be very familiar with these terms as simply like a person who has some kind of work experience or probably an educational domain, educational background in public health and probably social determinants of health. So that can be one of the major differences that if we are only hiring people trained in medicine to be eligible to be a part of this cadre, and their roles and responsibilities will, of course, be much broader. When pre-independence time, we only had these medical officers probably taking care of the diseases which are spreading fastly, or probably setting up of the hospitals. That time, we didn't have the concept of PHCs, CHCs. Now we
Yeah.
do have some kind of pattern. I think so. Their roles and responsibility will be much broader. Probably they'll also be involved in bridging the gap between different ministries, different departments. For example, when we consider women, Ministry of Women and Children also comes into play, but also Ministry of Health comes into play.
Right.
So I think that is extremely important. Plus, promoting research in these areas is something that IMS did not do. I think so. At this point in time, IHS officers can also be involved in figuring out the epidemiology, how diseases are spreading, why are diseases spreading, who is it affecting, and how to work on it. So these are things that IHS officers can work on. But on the other hand, of course, there are a lot of many things which are different. But I think there's one similarity which will remain common in IMS and IHS is the intent of having a cadre based on health, which is quite obviously
Right.
the intention of having a good health of people across the country. But I think it's still very early to say what it will be exactly based on.
Right. That's actually pretty interesting because, like you mentioned, right, health is not just like medicine and diseases, it involves like sanitation and even like research
Yeah.
for that matter. Now, we know that when COVID had happened, the world entirely witnessed like a great amount of loss, but also there was utter chaos over the past 2 to 3 years. And given how the state of Indian healthcare system is, how important is having a system like Indian health services is like, important for our country. Also, like from what I remember is that back in March 2020, Indian Medical Association also had a press release demanding for an Indian medical service. So what do you have to say about
Yeah.
that?
So this demand of an Indian medical, actually, I would want to call it as an Indian health service. I don't feel
Right.
like calling it an Indian medical service because health is much broader.
Okay.
And I think this demand, which has been recognized by the medical association, by doctors associations and other people, has been for long. But you're correctly saying that it's COVID that has brought it into picture. It has highlighted it in past 20 months. The need for a separate cadre for IMS is very, very visible. So especially in the second wave, and I'm guessing you must remember that there was this massive shortage of mobilization of PPE kits,
Right. Yeah,
beds,
yeah.
health personnel, right? And I remember that,
Definitely.
yeah, and I remember I live in Haridwar and we had Kumbh that period of time. And I think
Oh,
that is where the second wave started in the country. And
yeah, yeah.
soon, yeah, and soon after, everyone at my place was COVID infected. And
Right.
someone in my family actually needed an oxygen cylinder.
Yeah.
And we have a hospital, the largest hospital, public hospital in the city, right opposite to my home.
Like,
And we
and also
couldn't,
like if I had to interrupt, like during the second
yeah,
wave, people were actually going on to social media to get resources, right?
yeah,
For
yeah,
oxygen
true.
cylinders, mask, and everything.
True, true. Imagine like people were, which is good, people were helping each other,
Right.
asking each
Yeah.
other to help, but there was this massive shortage. And that was
Right.
the social, economic, political failure that the country, and of course, a health failure that the country was going through. And so
Right.
this extraordinary crisis that had occurred in, particularly in wave two, but also in
Yeah.
wave one,
Hmm.
has clearly revealed that there is some basic lack of coordination between the administrators who are there to administer the health services, the medical professionals, and the public health officials. So there
Definitely.
is, of course, lack of coordination in information, in market, and all of this mistake, the consequences were actually borne by the country's ordinary citizens. It was them who were
Right.
losing their lives. So so that actually highlighted that we need someone, need an organization, need a service at place to mobilize things, to facilitate the essentials in a situation as extraordinary as the COVID-19 pandemic. But a lot of people say that bureaucrats are doing it. And at that point in time, actually, the bureaucrats who were not specialized in health were given these administrative responsibilities at health facilities, especially on government hospitals in major cities, were headed by IAS officers or PCS
Right.
officers from the state at that point in time, which they did
Yeah.
not have a knowledge about to make them understand why someone needs a particular drug at that point in time. They would take much more time to understand that. So
Definitely.
there
Yeah.
comes the need of someone who has a background of health, who understands people health with a much larger perspective. And we know that the situation plainly just slipped out of our hands. And because nobody actually had the domain knowledge of understanding the health.
Right. Yeah.
And it's so sad to say that we had seen wave one. We were still not prepared for wave two, and we're definitely not prepared for the ongoing wave three.
Definitely.
Everybody is positive. People,
Right.
there are there are silly restrictions being put. Night curfews probably don't make a lot of sense. But
Definitely.
then you are having elections. There are election rallies are happening. Who is in charge of taking control of it? And people are
Exactly.
suffering.
Yeah.
Everyone is positive. So I think the
Yeah.
pandemic has taught us a lot of things. One more important thing that the pandemic has taught us that whenever these administrators fail to improve the accessibility of health essentials at that point of time, there was there was a large rise of skepticism or mistrust towards the government amongst the
Right.
people. There was a
Yeah.
massive communication failure, and that is
Definitely.
why the people were not trusting the government. People were not trusting the people who were there to help them. They were not trusting the doctors. Even
Yeah.
what happened with Asha workers, right? The poor
Right.
women
Yeah.
were there, but in front line. They did not have expertise, but they were there for promoting awareness, were distributing
Yeah.
masks, and they had faced both verbal and physical violence. So
Yeah, I remember this one. This happened near my place itself. Like because ASHA workers were going
same
to play every homes, and
yeah,
they were
yeah.
checking up on people who were traveling from abroad and stuff. And they had to go through so much of verbal harassment because people either didn't
Exactly.
want to quarantine or like they didn't want to mask up properly. And it was such a hassle for everyone.
Yeah, true, correct. So the need of this IHS is more important now in the time of pandemic, but it's everlasting. It's not like 2 years down the line we don't have COVID-19 around us. We won't be needing
Right.
IHS. That's not true. The problem is much bigger. There is a broader need of health administrators in the country. And in India, what happens is that we do something about it when the situation has already occurred.
Yeah.
The majority of it is actually damage mitigation. We don't do
Definitely.
preventive things to control things, right? And this is also, I think this is also because the people who are put in charge, for example, district collectors are put in charge of seeing health in the particular districts. They don't have background expertise. And I'm saying that there are some people who are doing brilliant jobs with whatever they're doing. But you
Yeah.
also need to understand that only a doctor can solve a doctor's problem. So a
Right.
person who has studied something else will not be able to work on administer health problems in the country.
Yeah.
So this problem is much beyond just providing primary, secondary, and tertiary health services, right? We
Right.
need effective and efficient and fasting health policies. And all of this can only be done when there is a cadre at place who
Right.
gives complete attention to the problem and facilitates the situation better.
You're right. And also, I think adding on to that, now, since you said that, COVID sort of highlighted it, one more thing is with research and with epidemiologists and all being in place, communication with people also becomes more effective, right? Like currently, if you
Yeah.
do not have people who tell you exactly what is wrong, even with vaccination and stuff, we saw it happen where people didn't believe in vaccination and all of that.
True.
So like if there are people who have like domain knowledge in place, them breaking it down for the general public without the jargons and helping them understand the situation is absolutely important in preventing, further damage, right? Because like you said, India sort of believes in like damage control rather than doing something to prevent things getting worse.
Also, we need to understand that the health literacy of people in this country is extremely low. It's extremely low,
Yeah.
and it's only the people who understand health can better it, right? You can't be
Right.
expecting for someone else to improve the levels of health literacy in people. And because of these poor health literacy, people are making bad decisions. We
Yeah.
cannot blame these people for probably just depending on some immunity boosters to fight the pandemic.
Definitely.
There is a specific need of people who understand health to communicate with people whose lives are at risk to prevent situations from getting worse.
Right. Yeah, that is actually very interesting. But before we move on and continue this conversation, I would like to take a short break and we will be right back.
Hey everybody, it's been another great week on the IVM Podcast Network. On Storytellers and Storysellers, Vineet talks to founders Dinesh and Vivek about the path-breaking changes their AR edugaming startup PlayShifu has brought about. On Think Fast, Varun and Suchita talk to communications consultant Karthik Srinivasan. He shares his insights on brand stories, woke culture, and regional content. On Cyrus Says, a cock and bull episode with ex-producers Naveen Narona and Abbas Momin. Cyrus asks if they ever participated in a fancy dress competition. On All Things Policy, the Takshashila Institute folks discuss the importance of digital equity in achieving true progress. And on Probation Se Promotion Tak, Abhinav gives us tips to be mindful of before seeking a mentor. Also, just one quick announcement for everybody. Would like you to check out the new version of our Android app. It's available on the Play Store. It's a really interesting take on how to listen to podcasts. Do give it a look and let us know what you think. We're open to feedback on all of our social media channels. We're IVM Podcasts on Twitter, Facebook, Instagram, and LinkedIn. Also, do remember, if you're enjoying this show or any of our other shows for that matter, please do tell a friend. Word of mouth really does help. And don't forget to rate us on any of the platforms you're listening to us on. And you can also check us out on YouTube. And we have a number of channels there at ivmpodcast.com/YouTube where you can take a look at them. And finally, we'd like to thank our sponsors this week, Bank of Baroda and CoinSwitch Kuber. Thank you so much for making this possible.
So So, welcome back to All Things Policy. And continuing with my discussion with Mahek, we were talking about the need for Indian health services. Now, we understand why it is very important, right? We have discussed about it.
Mhm.
Why is it a need of the hour and how COVID has brought it like in the limelight to for us to understand why exactly such a system in place is absolutely important. Now, given all of that, so what are the recent steps that have been taken towards IHS? Because as far as I know, in March 2021, the Parliamentary Committee expressed its views in favor of exploring the possibilities of setting up such an exclusive service. So, and that, like, also, what are the thoughts of the current government about like establishing such a system?
Yeah. So the thoughts have been there forever now. So if we go
Okay.
back to 1961, when then there was this something called Health Survey and Planning Committee. If I'm not wrong, it's called Mudan Yar Committee, which
Okay.
also recommended the formation of an IHS cadre, which is 1961, which is I don't know how many decades back. So,
Yeah.
but you correctly said that recently the current government, the current regime has recognized the need of it. The other 15th Finance Commission also suggested that the card kind of be organized similarly to the lines of IAS, IFS,
Okay.
and
Yeah.
IRS. So when in 2021, this Parliamentary Committee on Health recommended the formation of such service, the Health Ministry sent circulars across states asking for their
Hmm.
views on such a move. But the thing
Hmm.
is, there is no follow up done on it. There is no data if the states have sent their views. There is no data
Okay.
if states did not send their views. So we know that one thing for sure that probably the current regime understands the need of such a candor, but
Right.
I'm not really sure if they really want to implement it and work towards it because it will also affect how the current administrative services are based. A lot whole new system
Right.
has to be brought into place to bring about IHS. But we know that there is a need, they have felt the need, and especially I also think that because there has been a lot of pressure from medical associations, from the
Yeah.
resident doctors associations. So and a lot of like private research groups have done special studies which have recommended the formation of such a cadre. So there is also
Right.
that pressure, which probably somehow facilitated this move that ministry asking states to give their opinions on IHS formation of IHS. But nothing has been done. Nothing has been done in execution of it right now, as of now.
Okay. 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 Wow. That's actually like so many decades worth of discussions in wanting
Yeah.
to form something, but like nothing being done. Right. So, like, when you think about it, when you sort of like, okay, since they keep talking about it, but nothing concrete has been done about it. So, I think one of the concerns regarding the IHS is that it will bureaucratize the healthcare system. And currently, the healthcare system is
Yeah.
very state government based. So then everything will become very much central government. And that is one of the concerns, right? So, what are the
Yeah.
other concerns regarding the establishment of an IHS? Like, what are the challenges do you see? And is there a way to tackle those challenges?
So yeah, so the point of bureaucratization is a very well versed point. There is a huge possibility that these
Mhm.
services will get into this top down vertical approach, will get bureaucratized, and
Right.
probably this will hamper the state services in
Yeah.
the country, health
Okay.
services in the country. But one thing that everyone needs to understand that bureaucracy is only going to grow. If there is no point, it's going to start shrinking. So
Right.
instead of not working towards having an IHS, we really need to work towards having probably new ways for this problem solving, probably have new encouraging innovation discussions and time spent into formation of this IHS. So one point which can be done is having properly assigned of leadership roles of
Right.
what stakeholder in IHS has to do what. Which
Okay.
I think if we start with a very small yet efficient IHS in the country, it's going to help. Bureaucratization
Right.
will always be a problem. It's not going
Yeah.
to stop. And it's also actually happening in other services also. We know that a serious
Right.
problem, but we really need to find out solutions where it does not impact the services which are meant to be provided to the beneficiaries, which are the people of this country.
Hmm.
But moving to the other part of your question, which is what are the different other challenges or the opposition that the cadre has faced?
Right.
So I recently had written an article on the need of formation of an IHS. And one person had pointed out towards, there was this one reply that the person had given to me about my article,
Okay.
who said that there are these IAS officers, right? And we know these people are intelligent. We
Right.
know they
Yeah.
have cracked the
Definitely.
toughest exam. So they are intelligent, they are capable.
Yeah. Yeah.
So they are doing a good job. And then I searched about these chief secretaries of health, which are, of course, IAS officers, and they actually are doing a great job.
Yeah.
So some of the states, probably in Andhra Pradesh, Tamil Nadu, these CHs
Okay.
are good to
Right.
doing actually a clapful job. So
Right.
then there is this one challenge. Then when there is already people in the system who are in charge of these health issues, why do we need to introduce a new cadre in one for all?
Okay.
That's one challenge that a lot of people have faced, and so that is why they don't want to introduce another cadre, because they think then there will be more people into the system. There are more challenges than one has to face.
Yeah. But like challenges do exist, right? But like you pointed out previously, that it's one step at a time, a small step that would potentially lead to something bigger.
Correct. Correct. And next major challenge that everybody faces, that also I am still working on, is that I face is who should be eligible to
Right.
sit for this IHS. A lot of,
Right.
if you ask doctors, if you would go and ask this question to any doctor who has studied medicine for 5 years, would definitely say to you that people who have studied medicine should only be eligible to
Right.
sit for the exam.
Yeah.
My point of concern comes when I know there are a lot of grassroots workers who are educated, who have probably a degree in public health, or they have studied epidemiology, they have studied
Right.
social determinants of health. They're very important. And a
Yeah.
person who has probably studied medicine in 5 years is also important.
Yeah.
But the groundwork they understand, or the dysfunctionalities that they understand, that's one big challenge. Who should be eligible to
Yeah.
sit for the exam? Should only educational background matter? Should people who have experience, probably someone who has 20 years of experience of working in public health in state of Chhattisgarh, would probably be more important than a person who has attained a degree in
Yeah.
medicine or health. So that's
Right.
one challenge, that who should be eligible. And for other civil services, we know that a person should only be a graduate, right? There is
Yeah.
no particular one degree required.
Right.
So are we actually making the exam even tougher when we are putting such eligibility criteria?
Right.
Second is like, how should they be trained? Because most IAS, IPS, IFS, IRS have some kind of basic exam structure, and then they have a basic training. So that how should they be trained? Should they be trained with IAS officers? So so introduction of an IHS will also mean that you have to change a lot of things in the system, in the exam process, in the training process, in the recruitment process.
Yeah.
So I think that's one more challenge.
It's basically like rebooting a system, right? You have
Correct.
to
Yeah.
think about everything all over again from the
Yeah.
ground up. Yeah.
Correct. Correct. And a lot of people then other also say that you cannot just, there is this common misconception that doctors are not good managers,
Okay.
and which I don't agree with. But
Right.
yeah, this one I was reading it somewhere that people say that there's a doctor's inability to manage or administer, and it should be considered as a universal truth. So all of these small challenges have hindered, have become hustle, and everyone has to hustle. This is not
Right.
a small change. So everybody knows it's going to be a revolution in the country.
Yeah.
Introduction of a health cadre. So I think nobody wants to take the responsibility of introduction.
Also, I think adding on to that, what I also saw was that now, for example, like a person who is working in certain part of a country, right? Say, suppose he's working on the northern side, maybe in a extremely cold state. Then he moves towards the southern side, which is like extremely hot. And
Yeah.
like the challenges, medical challenges there would also be a little different, as well as like,
Yeah.
you know, that people who do grassroots level work they may not be completely trained in MBBS or something like that, but are also doing some phenomenal work. So some basic training, or is there so some sort of like, you know, how we train ASHA workers and something like that. So
Yeah.
this solution can't be just like thought in one way. It should be sort of thought about in multi-dimensional way, I think. That's probably one of the ways to go about it, right?
Yeah. Yeah. True. Very true.
Yeah. Also, like now, like I think what you've reiterated time and time again is that IHS can't just be about medicine. It has to include things about like sanitation and public health and all of that, right? No, if we do take this forward and we have to build a system of IHS, so what kind of like organizational structure do you think we should follow? Or is there some sort of like organizational structure that is followed and we could potentially like be inspired from?
Yeah. So according to me, that people who clear the exam should be the health, should be appointed as the health officers of that particular state, or probably can be more divisional. It can be district wise also. Should be
Right.
it's my point of view. People who
Okay.
clear the exam and people who are trained in managing health should be given that opportunity. And
Okay.
under such people, we can have these grassroots workers, we can have frontline workers, we can have these
Right.
medical associations, non-for-profits, NGOs working for health can be a part of this, but should be under the person who knows health and who also knows to administer health. So
Right.
according to me, there are three major problems that we are facing. First, health in India is not very technical. We need technical competence.
Yeah, definitely.
First, that there are technical requirements that one needs to have. We cannot understand the health of 1.7 billion people who are extremely diverse and widely spread without having technological ability. Second, then there are administrative and managerial dimensions, that who's going to look after what, how should one be structured, how should the programs be implemented, who should be heading that program. That is second point. And third, which I'm very afraid that a lot of time people forget, is that there are social determinants of health. A woman from a particular community will have very different dimensions of health from a man who is living in another geography in the country.
Yeah.
So one thing I'm
Yeah.
extremely afraid of that is the social determinants of health. Therefore, I argue that the cadre must not only have this techno-managerial structure, but should also have this sub-cadre for the people who understand these social determinants
Yeah.
of health. Because health is for all. We are talking about universal health coverage, but if we keep focusing on one group of people, we will never be able to achieve that goal.
Right. Yeah, that's actually that's actually a very good point. And like, I agree with the whole socio-geographical determinants and everything, right? Because like you said, a woman from one particular geography is not the same. Like you can't determine the same thing for a man
Yeah.
with the different geography. That's actually true. But thank you so much, Mahek. This was a very interesting conversation and
My
a very,
pleasure.
very informative one. We got to know a lot about what exactly Indian health services are and what are the roadblocks. How was it like, what is the idea behind it? And the constraints that we are going to face if and when we bring this forward. Thank you so much for joining me in this conversation
Thanks.
today.
Hopefully the next time we'll talk, we'll be working on something on IHS. And the next time we have a discussion on this,
definitely.
probably there should be
Yeah.
something in the pipeline.
Definitely. We should do something about it. But thank you
Correct.
so much. And
Thank
to all
you.
our listeners, thank you for joining. Thank you for listening. And stay safe, mask up, and stay healthy. Bye-bye.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.
Working Monday to Friday glued to your chair making you feel dull? Worry not. Get your 5-minute weekly dose of travel around the world with postcards from nowhere. Join me every Thursday as I explore the strange, obscure, and fascinating parts of the world and bring out facets of travel you may not have thought of before. You can find us on the IVM Podcast app, website, or wherever you get your podcast from.
Habits? Routines? How exactly do they help us get better? Well, to simplify it for you, tune in to the Habit Coach podcast. I am Ashton Doctor, and I'm going to be here to help you get better daily with some simple, easy to do habits that you can easily adapt to your life. So tune in to the Habit Coach podcast from Monday to Friday, because I believe that awesome lives start with awesome habits.